the preliminary review, we know that people have been concerned about these results. On behalf of Eastern Health, I'd like to extend my apology for any worry or concern this issue may be causing or creating. I can assure people that we've been acting as quickly as possible, and we continue to move expeditiously through the full audit. While this occurrence appears to have a low risk to patients, I want to outline our next steps. We will finalize the details of our quality review process through which we'll review all images that were identified as having been read on a viewing station that's not meeting technical standard, to reassure all patients that their mammogram reports are accurate. We're doing this out of an abundance of caution. I'll next speak to Eastern Health's findings, and then I'll turn the podium over to the other CEOs on the call for them to speak to their respective regions. The Newfoundland Centre for Health Information, our provincial health information manager, has been working with the regional health authorities to help identify mammography images that were not read to technical standard. For Eastern Health, our review to date has identified approximately 3,800 exams, representing approximately 3,700 patients, completed between September 18th, 2018 and August 19th, 2022, which will require further review. Our ongoing review will be able to identify how many patients may have mammograms which will need to be reviewed, and further, how many of those may have potential discrepancies or differing interpretations. Eastern Health radiologists provide professional interpretation and consultation services to Lab Grenfell Health through a long-standing relationship. Accordingly, Eastern Health radiologists review the mammography exams for Labrador Grenfell Health. Due to this existing relationship, Eastern Health will be working with Labrador Grenfell Health to assist with their quality review process. Ms. Brown will provide those details to you shortly. In addition to the public advisory Eastern Health issued on August 23rd to notify patients of our preliminary review, we will follow the same format that Central Health has established. Specifically, each regional health authority will send letters to all patients whose images are subject to review, notifying them of our processes. Patients whose images do not show any discrepancies or differences in interpretations will receive a letter from Eastern Health and the other RHAs by the end of October verifying this. These will be sent as soon as we have those results. You will note that this date is a month later than Central Health. This is reflective of the volume of exams that need to be reviewed from the other three regional health authorities. For those patients whose images show possible diagnostic discrepancies or differing interpretation, Eastern Health will be reaching out to their primary healthcare provider, contacting the patient by phone, and following up with correspondence by letter. These steps will be taken as soon as possible, but no later than the end of October, to make sure that patients are aware of next steps. If people have any further questions, they can reach out to us through the toll-free number that's been set up for Eastern Health, which is 1-833-960-4574. We encourage people to reach out if they have any questions or concerns. Eastern Health sincerely apologizes for this occurrence, and we're committed to providing quality service with the safety of our patients first and foremost. We also apologize to anyone who may be worried or inconvenienced in any way as a result of this occurrence. Our quality review will help reveal to us the reasons and contributing factors as to why this happened, so that we can take the appropriate measures to ensure it does not happen again. We are taking all required steps to address this occurrence in a timely and thorough manner. And we're committed to sharing information with patients who may be impacted as quickly as possible. We want to assure any affected patient that we're committed to alleviating the concerns many may be feeling at this time. We also want to assure any patients that have scheduled mammograms in the days ahead that they are not affected. Your procedures will be proceeding according to schedule, and I assure you will be read according to technical standards. I'll now ask Heather Brown, President and CEO of Labrador Granville Health, to speak on behalf of her regional health authority.
Thank you, Ken, and good morning, everyone. Labrador Granville Health's situation is a little different from the other regional health authorities in that our health authority does not have radiologists as a part of our staff to perform these procedures. So while Labrador Granville Health provides a suite of diagnostic imaging procedures at facilities across our health region, including mammograms, radiologists at Eastern Health read and report on the tests that are done at Labrador Granville Health. Following Central Health first advising of a multi-patient occurrence involving mammography images, we reached out to Eastern Health, and as Mr. Baird has said, a preliminary review began on August the 23rd. The Newfoundland Labrador Centre for Health Information, our provincial healthcare information manager, is working with Labrador Granville Health to identify mammography images that were not read to technical standard. NILCHI's preliminary review suggests that approximately 2,530 exams completed between the period of September 18th, 2018 to August 19th, 2022, which represents approximately 2,095 patients, will require further review in Labrador Granville Health. This number represents approximately 29% of the approximate 8,698 exams conducted during this period for approximately 5,071 patients. This number may change as the review proceeds. Labrador Granville Health will send letters to all patients whose images are subject to the review, notifying them of our process. Labrador Granville Health will continue to work closely with Eastern Health to determine a process to review all images that were identified as having been read on a viewing station that was not to technical standard to identify where there are discrepancies. Following the full review, patients whose images do not show any discrepancies or differences in interpretation will receive a letter from Labrador Granville Health as soon as possible and no later than the end of October confirming this. If the review confirms diagnostic discrepancies, Labrador Granville Health will reach out to all impacted patients' primary healthcare providers, and we will also telephone those patients directly and follow up with a letter. These communications will be done by the end of October to make affected patients and their primary care providers aware of next steps. I know this news is unsettling for patients and families, and I'm very, very sorry for this. We are here to provide safe, quality healthcare services to the people we serve. And the last thing we would want would be to add to your healthcare worries or stress. And we do apologize for any concerns and any experiences for our patients. We are taking every step to address this issue in a thorough, safe, and a transparent manner as possible. And we want to ensure that your questions and your concerns are heard and that you'd have access to accurate and timely information. Please call the toll-free number at 1-833-960-4574. That's 1-833-960-4574. For patients with scheduled mammograms at Labrador Granville Health, those will go ahead as scheduled, and these mammograms will be read to technical standards by Eastern Health radiologists. Thank you for your time today. I will pass the podium to my colleague, Interim President and CEO of Western Health, Michelle House.
Good morning, everyone, and on behalf of Western Health, I want to thank you for joining us this morning. The occurrence at Western Health is the same as what Central Health detailed in their media availability last week, and the same as what's been outlined by Eastern Health and Labrador Granville previously. Our review is regarding the viewing of mammography images on the proper viewing stations, and not the mammograms themselves or the way the exams were conducted. While this occurrence appears to have low risk, it is important these images be reviewed as quickly as possible, and we're taking all required steps to address the occurrence in a timely and thorough manner. We are committed to sharing information with people who are impacted as quickly as possible. With support from the Newfoundland and Labrador Centre for Health Information, NILCHI, and clinical experts, the preliminary review to date has identified approximately 7,554 images within Western Health, which will require further review, representing approximately 5,956 people. Please note that these numbers may change as the review process progresses. The time period for this review is between October the 1st, 2013 and August 22nd, 2022. You may note this date range is different than the other regional health authorities. This is because each regional health authority implemented PowerScribe, the reporting software used in medical imaging at different times. PowerScribe has been implemented in Western Region since 2013, which made data accessible to that date. Western Health is conducting a review of all images that were identified as having been read on the viewing station that was not to technical standard. And we will notify by letter all people whose mammography reports are subject to this review to notify them of our processes. Following this initial notification, one of our next steps is to finalize the process to review all reports that were identified as being read on a viewing station that was not to technical standard, and to establish a timeline for how long this process will take. Based on the review, reports for people that do not show any discrepancies or differences in interpretation will receive an additional letter from Western Health verifying this. For those people who, based on the review, their reports show possible discrepancies or differing interpretations, Western Health will take several additional steps, which were reviewed earlier by my colleagues, but I'll repeat again. We will be reaching out to their primary healthcare provider, we'll be contacting the people impacted, and we will follow up with a letter. The quality review will also take place to assess mammography viewing practices, including a retrospective audit, investigation, root cause analysis, and the identification of opportunities for improvement. We are currently in the early stages of review and will have more information as we move through the process and have a better understanding of the impact. Please be assured that within Western Health, scheduled mammograms are not affected. They are proceeding according to schedule, and only viewing stations that meet the technical standards are being used for the review of mammography reports. Current and future mammograms will not be affected by this occurrence. Western Health highly values quality services. The safety of all people in our region remains our priority. Our goal is to ensure that our procedures meet standards while providing safe patient, client, and resident care. We understand that some people may be concerned and anxious. I want to apologize for any concern this has caused and thank them for their patience and assure them that we're moving quickly and thoroughly. For more information on counseling and other services and supports available, you can call the mental health line at 1-888-737-4668. So that number again is 1-888-737-4668. If you have further questions or concerns not addressed here, or to obtain a copy of your medical record, you can call toll-free by phone at 1-833-960-4574. Again, that number is 1-833-960-4574, where you'll be prompted to connect with a Western Health representative at our Client Relations office. Thank you again for attending, and I'll now pass it back to Mr. Beard.
Thank you, everyone. We'll now open it up for media questions. We have 6 members of the media joining by phone today. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Andrea Gunn of All Newfoundland and Labrador. Please go ahead, Andrea.
Sorry about that, guys. I accidentally muted myself and then had to unmute myself. My question is probably for Dr. Pickles, but I'm wondering, so I know now that you guys are looking at mammography scans that go from before 2019, from like, which was the Central Health kind of like parameters. I think you said 2013, but I thought you said during the last announcement on this that the rules, I guess the rules that it had to be viewed on a 5 megapixel screen only came into, I guess, force in 2018. So I guess I'm just a bit confused as to why we're going back so far if the rules only changed in 2018, assuming that pretty much every mammogram was read on those smaller screens before then, or maybe I'm misunderstanding, but hopefully someone can explain.
It's Dr. Pickles here. There we go. So I'm not 100% sure on the exact date. 5 megapixel monitors have been around since 2012, I believe, but not always instituted in all places, but they were available in different RHAs. So the reason we actually chose those dates from 2013 in Western, 2019 in Central, and 2018 in Eastern Health and Lab Grenfell Health actually has to do with our ability to accurately obtain data, not the monitors at all. With the institution of PowerScribe, which is a reporting tool we utilize, this reporting tool is integrated with the exact monitor on which the examination is read, so we can obtain accurate data. And this tool was implemented in the different regional health authorities at different times. So those are the reasons we chose those dates. Prior to those dates that we came down on, there was a different reporting tool utilized, which was not integrated with the monitor. It was a standalone separate system, so we could not determine from reports where those examinations reported. The other thing to remind you is most mammography is a recurring, predominantly a screening tool. So most women, depending on family history and a few other factors, have an examination performed yearly or every 2 years. So during these timeframes we have landed on, most women will have had a follow-up examination performed, and if not so prior to those dates, they should have also had subsequent mammograms performed.
So I guess my follow-up would be why, if the regulations in Canada didn't change until 2018 and it was acceptable before then to read on 3 megapixel screens, presumably, why go back past then? And yeah.
I honestly, I'm not sure I understand the question.
Dr. Pickles, if I can step in here.
Yes.
So the standards that establish the, I guess, requirement for the high resolution monitors, the relevant standard, the Health Canada Safety Code 36, was established in 2013. I think the discussion around the 2018 date was referencing the Canadian Association of Radiology Mammography guidelines that were updated, I believe, in 2018.
That would make sense. Thank you.
Yep.
Thank you, Andrea. Our next questions are from Noah Shepard of VOCM. Please go ahead and ask your question.
Hi. I was just wondering here, in terms of upgrades or hardware upgrades, because of course this is affecting the viewing stations. What is the scope going to be with this in terms of timeline? So are upgrades happening immediately? Does further review need to take place first? Where are we with that?
So that's part of our quality review. We are currently doing an inventory of the available workstations to identify their locations across the RHAs. And then the review will determine the appropriate number that's required. If we don't have enough or if we have too many, determinations will be and recommendations will be coming through that quality review process.
And with
the review is
mammography
currently
services,
underway.
sorry, can you repeat that?
Sorry, I was just saying the review is currently underway.
With mammography services, are they going to be harder? Is there going to be lower availability now that those reviews are underway, or will the same amount of appointments resume?
Yeah, no, I want to reassure there is no implication here for the quality of mammography service. So there will be no impact on the numbers of mammography or location of mammography services. This is very limited in scope to the monitor that has been used to review a mammography image. It's not going to impact on the availability of the mammography service.
Thank you, Mr. Baird. Our next questions are from Mark Quinn of CBC. Please go ahead and ask your question.
Yes, thank you. Central Health has said that in its preliminary review and its ongoing review, it has found 4 discrepancies so far, or different interpretations of the readings. What's been found at Eastern, Western, and Labrador Grenfell Health regarding the review so far of mammograms?
So across the other RHAs, we have not yet begun to actually have those images or exams reviewed. That's going to be our next step. We're just finalizing our quality review process now. And so we anticipate that that will begin imminently in the next day or so.
And just as a follow-up, will Dr. Wadden also be doing that review? And will that mean there are a few people available to do normal screening?
That's one of the reasons why we have yet to finalize how we're going to conduct this review. Dr. Wadden, her capacity is being used to support Central Health. We need to identify the additional radiology supports that we can bring to bear to support the other RHAs. So we'll be looking internally for peer review and potentially looking outside of the province for an external support if necessary.
Thank you.
Thank you, Mark. Our next questions are from Colleen Lewis of NTV. Please go ahead and ask your question. Colleen Lewis, do we still have you with us? Colleen seems to be having technical problems, so we will move on now to Peter Jackson from the Telegram. Peter, please go ahead and ask your question.
Hi, good morning. So by my estimate, this is another 13,000, over 13,000 tests, most of which will be in Western Health. We were given a timeline of September for Central Health, and then now October, I believe. What is the timeline we're looking at, particularly in Western Health, for a review of all these tests?
Hi, thank you for the question. And in my update, in terms of, you'll note, I didn't give the date in terms of, because obviously the number is higher in our region. So we do need a day or two to determine, when we'll be able to have the review complete. A part of that goes back to what Mr. Baird referenced in terms of the process for that review. We may need some additional support in order to do the review in a timely way. But I do want to reiterate, as our number one priority is to have these images reviewed as quickly as possible.
Okay, thank you. And I want to get this straight about the technology used in this case. Are we in fact looking at the health authorities not upgrading to federal standards in 2013 as one would expect them to? Is that what we have here?
Peter, if I can step in and address that question, we'll just wait for the switch. So with respect to that, at this point in time, we wouldn't want to speculate. That is one of the elements of the quality review, which will be undertaken to understand all of the contributing factors that, created this scenario where we have this occurrence. And we will certainly be very transparent with the recommendations and the results coming out of that review.
Thank you very much, Peter. Next, we'll go to Heidi Adder from CBC. Please go ahead and ask your question.
Wonderful, thanks so much. So sorry, I was just waiting to be unmuted there. I believe all is well. So with Labrador Rental Health specifically, CEO Heather Brown, communications are to be done by kind of the end of October at the latest. For people needing to be rebooked, is there any kind of a timeline on when they should be planning potentially, okay, if I do need to be rebooked, it would be November, December, or will people needing to be rebooked due to any discrepancies be waiting until the new year? Is there any kind of timeline on that?
Thank you, Heidi. It's Heather Brown. I just want to reiterate that at this point in time, we are reviewing the results and looking at whether there would be any requirement for any patients to have their tests reread. So the determination of a patient actually needing another mammogram is preliminary and would be a part of that review. But I would like to assure that any procedures that would be required as a result of the review patients will be notified if their results have to be reread. That will go to their primary care provider. They will also be notified by telephone and with a letter. So it's a little early to determine whether there would actually need to have a procedure, although it seems unlikely, but that will be a part of the review that will be ongoing. And certainly anything that's needed to allay the fears of any patients and follow-up would take high priority. And would certainly be a part of ensuring that patients get access to whatever care they need as a result of the review.
Thank you very much. Now we will go back to each reporter to see if you have one final question. Andrea Gonneval, Newfoundland Labrador, do you have a final question?
Hi there. Yeah, I'm wondering if anyone in any of the health authorities have been in contact with health authorities outside the province, and if there's any idea of whether or not this is just something that's an issue in Newfoundland, or if it could possibly be something that other provinces and health authorities in other provinces have to look at as well.
It's Ken Baird from Eastern. I have no doubts that across the country, other jurisdictions are having a look at their practices based on the discovery here in Newfoundland. However, we have not reached out to other jurisdictions. I think our focus is internal to our practice to ensure that we're focusing on patients and what we need to do to reassure them.
Thank you, Mr. Baird. Noah Shepherd of VOCM, do you have any final question?
I do. I guess I'm just wondering now with a new standard coming in 2018, how does the review process of this go from year to year? Is the technology reviewed often, or is this something that is not reviewed until it is upgraded? Sort of what's the maintenance or review standard?
As Ken Baird, I'll try and tackle that one. So it's not that the standards around the monitors change. The standard for reporting mammography images in Canada has long been the 5K high resolution viewing monitor. For every monitor that we do have a quality assurance program in place where we inspect using, our physicists and PACS support personnel, analyze the resolution of the monitors on an annual basis to ensure that they are meeting specifications. And if we discover a monitor that is failing that inspection, then it is replaced. So we do have a regular ongoing maintenance program for our monitors. It's not a question of substandard monitors here. The question is that, unfortunately, a 3K monitor or a 3 megapixel monitor was used as opposed to the 5 megapixel high resolution monitor to report these mammography images. And I think it's important to understand that when you're sat in front of the monitor workstation, there is no physical or identifiable cue to the individual sitting in front of that monitor, whether they're looking at a 3K monitor or a 5K monitor.
Thank you, Mr. Baird. Mark Quinn from CBC, do you have a final question?
I do, thank you. I think for a lot of people, the Cameron inquiry is, even though it's quite a while ago, is fresh in their minds. When that happened, there were reassurances that breast cancer care would be fixed and there would be no future problems. But here we are, and I think people are reacting quite swiftly with concerns and even, I think it's fair to say, anger. I've heard people say that they use the word furious about this. So what do you say to people whose faith has been shaken in the health authorities' ability to provide quality cancer care?
I can start in terms of Michelle from Western Health. In terms of, I think all of us want to acknowledge, and we did acknowledge that, we understand that people would be concerned, about this news and angry, as you have indicated. And I think it's fair to say that, patient safety across our health authorities have improved significantly since the Cameron inquiry. Lessons learned, there's lots of quality controls that we put in place since that time. And, we are very committed to reviewing, this recent issue as quickly as possible and following up with the patients impacted as soon as possible as well, but certainly understand people's anxiety and concern around it.
Thank you. Next, we're supposed to go to Colleen Lewis, but I don't think we've been able to reconnect with Colleen at this point. So next we'll go to Peter Jackson of the Telegram. Peter, do you have a final question?
Yeah, can you explain why the change in standard and what it is about 5 pixel that is so important for viewing mammograms only?
I think Dr. Pickles might be the best.
Yes, I'll try and answer that the best I can. Historically, mammograms were read on a film, and when we went to digital imaging, reading mammograms on a computer, we tried to ensure that the resolution was as close to a film mammogram as possible, and that's where the 5 megapixel monitors came into play, and that was the closest resolution they'd say. My analogy would be for the musician purist an album versus a CD. So an album is analog and a continuous play, whereas a CD is a digital snippet, ones and zeros. So it's the similar thing in the visual world. And with the change, we were assured that the 5 megapixel had the same resolution. But I do want to say that as with these are all high resolution monitors. A 3 megapixel monitor is still a very high resolution monitor, and there comes a point where the human eye struggles to discern the pixel picked between a 5 and a 3. But the basis, the historical reason that the 5 megapixel came in for the mammograms was from film screen to digital imaging, and that kept the same resolution, and that was where the standards of practice were set.
Thank you, Dr. Pickles. Now we'll go to Heidi Adder for one final question. Heidi, do you have another question?
Yes, sorry, my apologies. My phone cut out during my 2 questions. So lastly, for CEO Heather Brown, will Labrador-Grenfell Health be looking at getting their own radiologists who can actually interpret these and read these in-house in the wake of this?
Thank you, Heidi. And as noted, certainly the review will look at all factors, including the provision of service. However, it's not uncommon for regional health authorities such as Labrador-Grenfell to rely on services from health authorities that require, have more tertiary level services. And of course, as we know, in the work towards a provincial health authority, which is ongoing, that will be part of the discussions in terms of how do all parts of the province continue to have the services that they need in a collaborative efforts in one provincial health authority. So certainly that will be part of the conversations as well ongoing.
Ina, if I may add to Heather's comments, I think it's important that we restate here that there is no quality concern with respect to the reporting of the mammography exams by radiologists. There is no question about the diagnoses in reports. So we're very confident with the quality of our mammography services. We're, through an abundance of caution, just taking this step to go back and review images that we now know were read on 3K monitors to ensure that nothing has been missed in that process. But with respect to the quality of the radiology services being provided, there is no question or concern as a result of this.
Thank you very much, Mr. Baird. Thank you, everyone. Mr. Baird, do you have any final comments that you'd like to add today?
I would just like to again apologize on behalf of Eastern Health and all of the regional health authorities. You know, we are very sorry that this has occurred, and we are taking the steps to ensure that we have systems in place going forward. We can assure all women in the province that mammography reads will be done on 5K monitors henceforth, and we will ensure that the review process and any required follow-up is done on a timely basis. So again, on behalf of the RHAs on the call today, I extend that apology.
Thank you, Mr. Baird. Ms. Brown, do you have any final comments today?
Thank you, Gina. Again, want to reiterate our apology for our patients who are experiencing any concern related to this situation. We will be working in consultation with Eastern Health as well as the other regional health authorities in the quality review to find, first of all, of course, to address any concerns that are a part of the review and to look for ways that we can continue to improve the quality of services that we provide in the province, and also to reassure patients and again to say that any concerns that you may have, you know, that we please reach out so that we can work through concerns and also ensure that patients have access to the information that they need through this this time period. Thank you.
Thank you, Ms. Brown. Ms. House, do you have any final comments today?
Yes, I just want to reiterate as well that we understand that many people might have questions after today, and we want to keep this dialogue going. So, you know, please reach out to the numbers that we provided today. And again, on behalf of Western Health, I'm sorry for any concern this is causing for you, and we're committed to provide regular updates around this. Thank you.
Thank you, everyone. This concludes our news conference today. Please enjoy the rest of your day.